Hello and welcome to the Rays of Hope program brought to you by the Purchase Area Sexual Assault and Child Advocacy Center. I'm your host today, Mary Foley, and I would like to welcome you to today's program. We're going to be talking about some new information, and we're going to be talking about how community involvement really does make a difference statewide. And I'd like to welcome to the program a special guest, very special guest, all the way from Frankfort, Kentucky today, Mary Lee Underwood. Welcome to the program.
Thank you, Mary. It's nice to be here.
Well, Mary Lee, on this program, we use this platform to educate the community about the services of the Purchase Area Sexual Assault Center, about issues that I feel, that we feel are important for the community to be aware of as it relates to issues of child sexual abuse and sexual assault. And I cannot put into words adequately how grateful I am to be sitting across from you today with such expertise and knowledge, but also I know your heart. I've worked with you and I know your heartbeat for this issue and the tireless work that you have done to improve services to victims. And so I'm just grateful that the community is going to get to hear from you today. So I'd like for you to take just a moment to introduce to our audience who you are and where you're from, and then we'll get to the content today.
Well, thank you.
You're welcome.
We could have a mutual admiration society.
Yes.
It is my pleasure to work with you here, and I have so much respect for the work that the Purchase Area Sexual Assault Center does, KASAP, as we call them. I work for the Kentucky Association of Sexual Assault Programs. As you know, KASAP is the umbrella group for the 13 regional rape crisis centers in Kentucky. Kentucky is somewhat unique in that we have funded victim services throughout the Commonwealth. Our legislature made a commitment to doing that many years ago and has upheld that commitment. So we have one rape crisis center in every area development district.
Okay.
So in the same way that the legislature sets aside money for roads and sewage and other fundamental services, our legislature sets aside funds for fundamental victim services. So we have one rape crisis center, one children's advocacy center, and one domestic violence program in each area development district. So KASAP is the umbrella group, if you will, for the rape crisis centers.
Right.
It's been my pleasure to work for the association for almost 9 years now.
Wow.
Yeah, and before that, I began my career almost 20 years ago now as an advocate when I was a social worker. Now I'm an attorney. But as a social worker, my very first practicum was for the Bluegrass Rape Crisis Center, where I was trained to respond to crisis calls and go to the hospital. It was one of my first jobs, going to the hospital when individuals would come in following sexual assault, seeking medical care. And an advocate would be dispatched to be there with the individual who needed services and be there throughout the exam to provide information and resources and advocate to ensure that they received everything in as efficient and as appropriate manner as possible. So that's how I started out my career, and almost 20 years later, it's my pleasure to still be working in the field and to get to be part of improving the system throughout the state. And I believe that we're still on the cutting edge in Kentucky and doing some work that I hope will be useful to the entire United States.
Well, and it's really something, that Kentuckians should be proud of, that there are many things that we would like to improve in our state, and this is one area that, starting with, you said, the commitment of the General Assembly, and then throughout, that we are really making some progress. And so you have tasted, if you would, the frontline field work, and now in Frankfort working to provide technical assistance and training and help develop policy and changes. So just briefly tell the viewer, where have we come? How have we improved since when you went to the hospital? Because we still do that. That's still something victims can expect. We still do that. We still go to the hospital. How have we improved in 20 years?
Well, one of the big changes over the last 20 years has been ensuring that services are available throughout the Commonwealth. And that is not the case in other states. We have the 13 regional rape crisis programs, and most of them have satellite programs. So if all told, we have about 30 rape crisis programs throughout the Commonwealth. That's unique. I have lived in other states, and in most other states, the services are centered around metropolitan areas. So it is unique and special that here in Kentucky, a victim can get services in their community or very close to home, if not in the city in which they actually live, or the county. You know,
Sure.
we work
Sure.
on counties here.
Yes.
So it is very special that we have been able to develop that sort of infrastructure to ensure that victims' needs are met. We've come a long way also in ensuring that services for victims are available at no cost or at low cost. The project that we're going to talk about today is being fueled, if you will, by some national level changes, but when this protocol came down on a national level, we were ahead of the curve.
And what protocol are you talking about?
We're talking about how sexual assault forensic medical exams are provided and ensuring that those are available to victims regardless of whether they report to law enforcement at the time of the medical treatment. Safe exams is what we like to call them. The concept is that the exam should always be safe for the victim. It's a sexual assault forensic medical exam, which is a mouthful. So we call them safe exams. And we want to make sure that victims can access that exam even if they don't want to report to law enforcement or if they're not sure if they want to report to law enforcement. In Kentucky, exams have been available in this way to victims for a long time. We had we do have some changes that we're in the process of making to meet the current national standards, but we were leaps and bounds ahead of other folks. In other states, they don't necessarily have a standardized protocol for doing this. They don't have a requirement that hospitals provide those exams. Evidence collection kits aren't standardized, and we did that 20 years ago in Kentucky. So,
well, and just to provide the viewer with some background of how this plays out in everyday life here in our local hospital, we have a call. It comes to the center, or a victim arrives at the hospital, and they report that they have been assaulted, and that enacts a chain of events.
Yes.
And so what you're saying is now in Kentucky there is a standardized way that we respond, and
Yes.
one of the pieces of that is the law requires that a hospital contact a rape crisis center.
Yes.
And so an advocate is dispatched, and that's the work that you began to do 20 years ago,
Yeah.
going to provide that support while a victim was at the hospital. So now if we fast forward with the viewer till now, what you're talking about and you're alluding to is a project that even makes care better for victims and provides them a little bit more power in whether or not they want to make such a critical decision as whether or not to report this crime to law enforcement or not, and does that impede or enhance their medical care.
Right.
And so let's start there. Let's jump right into a victim goes to the hospital and they, at that moment, realize, I need medical treatment. What happens now?
Well, the protocol should be that the Rape Crisis Center is contacted immediately so an advocate can be dispatched. The victim has a right to have an advocate there, a legal right to have an advocate there, so that should happen early on. The healthcare provider should then ask the victim whether or not they want to report to law enforcement, and they get a choice. Historically in Kentucky, a call was immediately placed to law enforcement, and a lot of folks think you have to, because of our mandatory reporting laws. What folks need to know is that mandatory reporting laws only apply in certain cases of child abuse.
Okay.
And other than that, an individual has the right to choose whether to report to law enforcement. There are other cases that must be reported to the Cabinet for Health and Family Services, where there is spouse abuse or there's abuse of an adult with a disability who's unable to care for themselves.
Okay.
In those cases, we have mandatory reporting to the Cabinet for Health and Family Services, or Social Services, as many people refer to them, or perhaps we call them DCBS, or however you call them. But there's been a lot of misunderstanding about what the law actually requires. So that's a big part of the project that we're doing now, is actually looking what the law requires and remembering that unless the law requires reporting, the individual has the right to choose.
Okay.
It's a right that's been reinforced a lot over the last several years by HIPAA, for example.
Okay.
Reinforces that patients have the right to make choices about their health care decisions. So it is consistent with HIPAA and with the United States Constitution that says that individuals have the right to be free from unreasonable search and seizure. now we have a specific right in our statutes in KRS 216B 400 that says the victim has the right to choose whether to report to law enforcement. So what should happen is that the hospital should ask the individual, do you want to report to law enforcement or not? Our experience with the pilot project on this is that about 90% of folks did.
They did report.
Did want to report initially. So that's great.
Mm-hmm.
The purpose of the project is not at all to decrease reporting.
Mm-hmm.
The purpose is to ensure that victims have the opportunity to choose
whether
to report or not, because that choice is so critical to the healing process for individuals who've been sexually assaulted. When someone is sexually assaulted, another person, an offender, has taken away control of one's body. And individuals who lose the ability to control their own body often feel like they lose the ability to control anything in their life. So in order to heal after a sexual assault, it's very important that the individual regain a sense of control. That's why this control in the healthcare setting is so critically important for victims.
And not to mention, in that state oftentimes, victims are not at a place to maybe fully be able to think through the intended or unintended consequences of their decision. And so creating that space for them to choose and to wait really was pivotal for victim services in the state of Kentucky. And so talk to me just a little bit about the importance, the purpose of what you're calling a safe exam and why this project is so important to you.
Sure. It's very important the purpose of it is really to increase the number of folks that are getting health care. Because we found that mandatory reporting to law enforcement created a barrier sometimes. You know, the call comes into the crisis line, I've been raped and I don't know what to do. Oftentimes the response from the advocate would be, well, it might be a really good idea for you to get health care to make sure that you're okay, that you haven't sustained an injury, that you get treated for sexually transmitted infections. What will happen if I go to the hospital? Well, historically the answer was they'll call the police, and here's what would happen. Click.
Exactly.
Because so many people in the aftermath of a trauma aren't ready to deal with the police. You know, you can think about that in relation to a car accident. You know, I had one not too long ago. I was like, oh man, now I got to deal with the insurance company and the police, and I really just have this meeting I need to go to. So, you know, it becomes a barrier for folks. So the purpose of this project is to create a system where that's not a barrier, so that folks can go ahead and get the medical treatment and begin getting connected to resources that they'll need to heal, and have a space, and go ahead and have the evidence collected, is the hope, so that it'll be available if the person decides to file a report, whether that's at the time, a day later, a week later, or some other time. So let's talk a little bit about the exam. I think you asked me about that and I went a different direction.
No, it's all important information that we're going to need to have. So our audience, maybe they're learning for the first time that first of all, they can call a crisis line. Second of all, they can have an advocate. Third of all, they have a choice. But maybe there's this piece of, what do I expect if myself or a loved one is in this position, and I go ahead and I go to the hospital. Now I know I do have a choice. What's coming for me in terms of this exam, and why in the world do I even want it?
Right. What to expect is health care.
Okay.
That's really what we want to ensure that all sex crimes victims have the opportunity to experience. If a person presents at an emergency department, for example, they should be screened for health care needs, just like when you present for any other reason. There should be an intake, just like with any other healthcare service, a detailed description of what's happened and what the injuries might be. So there would be a complete head-to-toe assessment of the person to identify any healthcare needs and provide treatment for any injuries that are noted. One interesting fact about sexual violence is that only 30 to 40% of people will sustain injuries that require treatment.
And I find that so flies in the face of our the way that TV portrays it, or the way that even the community at large would assume would happen with a sexual assault. So you're saying only a third, pretty much, will receive some sort of notable physical, outwardly visible injury.
Right. That is an interesting fact. It is counterintuitive based on what we see on CSI and Special Victims Unit. You know, we have to remember that those are made for TV shows, and so those are the sensationalized cases and the out of the norm, as are most things on TV. Aren't your standard, but something that is above and beyond, perhaps. But in many cases, there aren't substantial injuries, and I think that's in large part because, or it doesn't match up with what we think about sexual violence until you have had some experience working in the field. And what I've learned in my 20 years is that one of the most common responses that an individual will have when sexually assaulted is submission. You know, when I was a kid, I remember this program on KET where they talked about there are two responses in times of trauma, either fight or flight.
Right.
What I've learned as a victim service provider is that there are really three. There's fight, flight, or freeze.
Right.
And freeze is what so many people do. Many people, when confronted with an assault or with abuse, will freeze, will submit so as to minimize the injury. You know, there's a point at which a person may realize that I can't no longer control this situation. This offender is going to do whatever he's going to do, or she. We do see female offenders also, but primarily male. So this offender is going to do what he's going to do, and I just need to survive it. And at that point, the person makes a decision, whether conscious or unconscious, to freeze, to submit, to try not to get hurt any worse than you know, the minimum. And so that's what happens, which in a way is what we want to happen, right? It's good if the person makes it through the assault with minimal physical injuries. Unfortunately, that confuses the system a little bit, because what we see on television, what we've been educated is that, you know, somebody will be beaten, bruised, and bloody. That's the image that we have in our mind. But when you compare that to the natural human response, that helps us to understand why we only see injuries in about 30% of cases, where the individual maybe did fight back very aggressively, or the offender was one who, for whom force was an essential part of the experience. And
Mary Lee, one of the reasons why I think that is such important information for the viewer and perhaps for victims that could be watching our program today is that I think that also weighs into one's decision whether or not to go to the hospital, period.
Right.
In other words, if they don't see an injury, then I don't need to go.
Right.
And what you're saying is you do need to go because you do need to be assessed for internal injuries, you need to be assessed for sexually transmitted infections, you need to be connected with mental and emotional resources and support.
Absolutely.
So they can expect that when they arrive at the hospital. For those victims that say, I'm not sure that I want evidence collected, but I'm not sure that I don't want evidence collected, you're saying that this new law gives the space for that choice. And the new law became effective July the 15th of this year.
Yes.
So let's say we do have a situation where a victim decides, yes, I would like to report to law enforcement. Now what do they expect?
Well, then the call can be made from the hospital, and the law enforcement agency will present at the hospital. In many cases, there's an initial interview done at that time, and the examination is performed at that time with the health care needs taken care of, the head-to-toe assessment that we talked about, treatment for injuries, collection of samples. Then a follow-up interview would be scheduled with the victim. What people need to know is that it doesn't work anything at all like it does on television. There's not a team of forensic scientists waiting to evaluate that evidence and have it back to the law enforcement agency in 30 minutes or less. There is a turnaround time. It takes time to investigate cases.
We often tell our clients and those that we advocate on behalf of. You have just now begun a marathon. This is not a sprint, this is the first step.
Yes.
And there will be a series of steps, and it is a lengthy process.
Yes.
Why is this project important to you? Why is it important to our community?
It's important to our community for many reasons. One, because it really does provide a greater opportunity for people to get health care that they need, both in the short term and the long term, because at that initial exam, when the advocate's called, the victim will be provided with information about the range of services that are available to them, from counseling to support through court processes to financial resources that can help compensate for losses. It's the first opportunity for the person to tap into that support system that's necessary, and so many people in our community will need that. You know, sexual violence occurs throughout the community. There's unfortunately none of us are really fully protected. It can happen to anyone. So this will benefit everyone in the community, in that each of us will know someone or be touched by someone who needs those things. So it's important because people who become victims will have better access to services. The long range goal of the whole thing is a little bit counterintuitive, though. It's actually hoped that it will increase reporting and thereby increase community safety. Because, you know, when victims face the decision of all or nothing and choose nothing,
right,
then, you know, there's no possibility for pursuing those cases, or people will think there's no possibility of pursuing those cases. Having a new option where the person can get health care and have the samples collected and stored will mean that it's no longer an all or nothing decision.
And when you say they can have the samples collected and stored, how long?
Well, the law says that the hospital has to either store them or arrange for their storage for at least 90 days.
So this project that you've been involved in has created a window of opportunity for a victim who's been assaulted to come to the hospital, receive health care, have the choice whether or not law enforcement is contacted. There's an automatic contact if people are following the statute. And then if the answer is yes, I would like to report, but I'm not ready to, I would like to have the evidence collected, but I'm not ready to make a report, then we have bought them a 3-month time period.
Yeah, and some communities are doing it for longer.
Okay.
When we drafted the statute, we put it at least 90 days because we didn't want to create an overwhelming burden for hospitals to have to store evidence forever. Law enforcement officers also gave us the input that outside of 90 days, it might be impossible to find the other witnesses, any other evidence, you know. So really, the sooner the better in terms of reporting, you know, to collect other evidence and interview witnesses and do that. But when we drafted it, we put it at least 90 days because some folks will want to store them longer, and there's no reason that can't be done. So there's a floor, but not a ceiling.
Okay.
So for example, in Louisville, when the hospital programs there worked together to create their policies, they extended that to 1 year.
Okay.
So in Louisville, they're storing for at least 1 year. And they, again, drafted it so that they have the option to store longer. So there's a floor, but your community can make a decision, or your hospital or your agency can make a decision to store those longer if you have the capacity to do so.
And I know here in our local community, you know, our agency has been working closely with all the area hospitals, the ones right here in our Paducah-McCracken County area, and then outside of that area as well, to make sure they're aware and informed of the new law. They have their protocols in place, so the Purchase region has something to be very proud of. The protocols are in place, and those services can be provided. We are almost out of time today, but what I'd like to ask you is, if you could share 1 or 2 things with the viewer before you leave us today about the project, the importance of it, or about the issue in general, what would that be?
One or two things.
1 or 2 things that whether it's your own personal feelings about the situation or just a take-home point, what would that be?
I think that I would share that I really appreciate all the energy that professionals throughout Kentucky have put into making the necessary changes. It doesn't seem like a big change, but our policy has been so long, the automatic reporting so long, that it is a pretty significant change. And at first, it takes a while for folks to get their heads around it. It took a while for us at KASAP to get our heads around it. So I really appreciate all the energy that folks are putting into that. And I just want to let folks know that I see dramatic improvements. We're hearing stories back from victims now who say that it was a positive experience. I got what I needed and I decided to report. And we're seeing those cases move forward, you know. We were afraid that, or I heard concerns early on that people were concerned that be overwhelmed by all these people coming in and wanting these, and we didn't have any place to store them, and people were very concerned, but it's not working out that way. It's about 10% of folks, and the folks who choose reporting are saying, you know what, it was good that I got that choice. You know, I felt, and we're seeing folks having more choice, and that's really the ultimate goal. So I really want to tip my hat to the other professionals who maybe initially didn't really understand, but were willing to open their minds and come together at the table and work through the challenges and partner on this, and really just want to report back that we are hearing from throughout the state very positive results, and folks learning that it's not such a big change, and it's really not. It's not such a big change in how our hospital has to do business. It's not that expensive. You can do it, and that it really is making changing victims' experience in a positive way throughout the state.
So it's a minimal change for the system, but a real maximum change for those that really we created these services for to begin with, and that's the victim, to keep them front and center in all the decisions, you know, that we do make. Thank you so much for coming and for all the work that you've done on this project. And as you say, to the slew of professionals, law enforcement, hospital associations, lots of service providers coming together to put together a literal toolkit for hospitals and to educate. You are now actually going all around the state training on this topic, and that comes with sacrifice, so I appreciate that very much.
Well, we appreciate you tremendously, and I want to thank specifically PASAC. Has helped us a lot in developing the resources. These are resources sitting here that we're providing throughout the state, as well as the Hospital Association, who has been a critical partner in getting the word out, and the Board of Nursing and the Kentucky State Police and the Nurses Association and the Office of the Attorney General. And I probably better stop because I'm sure to leave somebody out, but I just can't say enough good things about how people have worked together. So thank you very much.
Thank you, and thank you for joining us. We'll see you next time.